All right. Hello. We are Team Ultrasound. I'm Maddie. I'm with Brad, Brandon, Marley, and Allie, and we're going to discuss whether or not we think ultrasound is worth it in a clinical setting. All right. So, how do we feel about ultrasound? Overall, we as a group kind of spoke about it and decided that we're all pretty familiar with ultrasound, and we've all gotten at least a bit of experience with this modality in some form, but we kind of recognize that it's not the best of the modalities. Just to kind of get into bias really quick, I think specifically for me, the ultrasound that I've seen a lot of ultrasound in the clinic, and honestly, I don't really know from my experience if it really has done much or not, because it's been paired pretty well with other treatment techniques and exercise and everything. So I think personally, I'm not 100% sold on it, but I'll let everyone else kind of go through how they feel as well.
So I I met a physical therapist who did his like capstone research project in his degree on ultrasound, and he was like, saying that it worked. So then that was like my first that's the first time like I ever like even heard of ultrasound for therapy. And then I worked in an actual clinic that had an ultrasound machine tucked away in a cabinet and was never seen. I've never seen the light of day. So I have never really had like experience with it until class. So my bias is that I think that it doesn't work, or at least like I wouldn't use it as a therapist, because there are like plenty of other modalities that could also work too.
Yeah, I was kind of the opposite of that, where I had like a lot of experience coming in. My athletic trainer in undergrad would always say it was good for like scar tissue, and back then I had no idea how it worked up until this class, really. So even going into my work as an aide, it kind of like my perspective started to switch a little, because all of the PTs were like if the patients want to do it, do it. It like some patients like it. It might not do anything type of outlook on it, but they were like, there's no harm in doing it. So if the patient wants to, go for it. And then, yeah, after this class, I'm a little conflicted on what my perspective is, but I think it's a lot of the PTs right now are on the same boat, where it's like, why not do it? But if they don't want to do it, then like no harm, no foul.
I'm kind of in the same boat as Brad, where all the clinics that I worked in used ultrasounds all the time. Every single day, I was doing multiple ultrasounds on different patients for different reasons. And some patients would ask, like, hey, what does this even do? Like, I don't feel a difference. And I'd say, if you don't like it, like, we don't have to do it. And then other patients, like, loved it and said it helped so much. Then we would do it and kind of use it as like a placebo and use it as our advantage. And I think just since it is like a costly modality, that we could prioritize, or I would personally prioritize my money when I'm a clinician into other modalities that have more research and better research and just more evidence that it's effective and stuff.
I personally came into it without much of any idea of what like ultrasound was. I had heard of it before, but I hadn't realized that there was two camps kind of going back and forth on if it should be used or if it shouldn't. So I kind of came into this with an open mind. So we can use that to segue into some of the literature. So we found quite a few systematic reviews, some meta-analysis, and a randomized control trial. And we kind of focused on the systematic reviews mainly because those are, as you see on the pyramid, the highest level of evidence, which you would think would be like a great thing. But in this case, almost all of the articles said that the evidence was low quality for the effectiveness of the use. And this includes treatments for chronic low back pain, venous leg ulcers, neck pain, plantar fasciitis, and lateral epicondylalgia, to name a few. And a lot of what some of the issues that we saw was that it was hard for many of these systematic reviewers to determine bias, because many of these studies that were found that they found for their systematic reviews did not have sufficient information on their methods of randomization. And a lot of them also identified varying degrees of selection, attrition, and reporting bias. Selection bias meaning that they were biased in their selection of individuals. That kind of goes back to the some of the issues of randomization and things like that. We also saw some attrition bias where people were leaving during the study, which was creating very low, like a high dropout rate was leading to low sample size. And then we also saw reporting bias, which is really not good, because that's when the decision to report your results is influenced by the findings themselves. So some of these studies, based on their findings, they just decided to not report their findings at all, which is a little strange. We also saw some issues with blinding and performance bias being that some of the control participants received treatments that were not given to the ultrasound patients. So an ultrasound patient would maybe just receive ultrasound, but then a patient not receiving ultrasound would receive other treatments like therapeutic massage and things like that. And so overall, the evidence quality and bias made it really hard to isolate any perceived benefits of ultrasound. It is worth noting that 2 of the reviews that we found on ultrasound in knee osteoarthritis reported that ultrasound was effective for pain management, but the studies used were not very consistent in their outcome measures, and they also stated that the data was not found on how long positive effects continued after treatment. So that kind of takes away from our ability to gauge their functional benefits. But overall, all the studies agreed that ultrasound is safe, but most are uncertain about their benefits. So in other words, there's little evidence to suggest that ultrasound is more effective than placebo. And much of that evidence that does give ultrasound the edge over sham has also been disregarded due to low quality of evidence.
Do you guys think that maybe like because like the results of that, what you just explained, is because more of like the limitations that we can't seem to like get past when studying ultrasound is mostly the reason why, it seems like, rather than like it doesn't work at all?
I mean, I think it's tough to say without more research at this point.
Yeah.
I think that could be the case, though, honestly. Like, just not enough like time and effort has been put towards it. But yeah, I don't know.
Right. And that's kind of like the issue with it, is we, after all this study, like all these systematic reviews, we really just don't know. There's too much bias, too much, like you said, it could be issues with, you know, I'm not saying that ultrasound doesn't work. The literature kind of points to that, but the evidence is so poor quality and there's so much bias involved that it's impossible to say for sure.
Okay. So is ultrasound effective, you guys?
Maybe.
Yeah, maybe, right?
Deep tissue heating, I think it can be effective for
Yeah.
treatment, if that's what you're targeting. If specifically like just that one, for me, I think it's effective.
I mean, like in theory, it should work. After modalities now, we know the mechanics of it. Like,
Right. I was
there
thinking
should be some benefit. And I would think that it'd be easier to find some valid evidence on it, but it's been like this for years where like nobody really knows. And so, yeah, we're just stuck in this gray area and we don't really know for sure if it works or not.
Yeah. I was thinking the same thing. Like, based on like when you learn it in school, you're like, oh, this sounds legit, right? Like, okay. But then what does the literature actually say? And there's just not enough like scientifically like based things to, or evidence to support your actual opinion on it.
Yeah.
Outside of like,
Go
ahead.
No, you go.
Outside of our modalities class, did you guys ever have ultrasound done on you?
No.
Yeah.
Nope. Never
I've
felt.
had it a few times and I never felt anything at all. It kind of just felt like someone was squishing gel around, but like I never noticed the tissues heating up, and it could have been a parameter thing where like, I don't know, I was an aide, so just being like, oh, I'll just do the preset ones because I don't know what any of them mean. but like I never felt a thing. So it's really tough to like support it when you've had it and don't see anything happen.
Yeah.
Mhm.
I think that's where like placebo effect comes into play, where like patient be like, what is this doing? And I'd be like, oh, it helps you heal, helps bring down inflammation, like it's gonna help. And then you'd be like, oh yeah, I love that. It was great. But like if you tried it and you're like, I don't know what this does, but we're just gonna see, then you might not have the effect because you don't have that placebo effect paired with it. But I think regardless of it being effective or not effective, if you want to use it and your patients want to use it, then I don't see the harm in that, and vice versa.
Yeah, for sure.
Cool.
Mm.
So I
Oh,
was looking at this a little bit. I was just trying to find all these different units online, and they had like portable ultrasound units that you could get for like a couple $100, which I would imagine is not the highest quality. The Chattanooga units that we typically see in the clinics, there was like two big ones that I found. There was the like portable one that almost looks like a thick laptop. That one ran about $1,000, and then there's the one that came on the big tower with like the stem unit, and those ran for about 3K. And so when looking at the cost benefits, it's kind of tough to like justify getting it if you don't already have one, but also every clinic I've ever worked at had one. So I guess relative to a lot of the other equipment that you might see in therapy, like did you guys ever have those vestibular platform type things that were like, I don't know, probably 50K to get? Like if you're comparing that to getting an ultrasound unit, like obviously just invest the $1,000 if a patient's gonna like it. But
Yeah.
again, I think it's kind of clinical judgment at that point what you want to do. I wouldn't prioritize it over a lot of other things.
Right.
Yeah, I agree. I would only use it if it was already in the clinic. I wouldn't go out of my way to like, hey, let's go buy one. Like, because a
Right.
couple of patients are asking for it. Like, yeah.
Yeah. It wouldn't be a great clinical judgment to make a multi-thousand-dollar purchase off of shaky research, but I don't
Seriously.
know. That's just my thought. All right.
Yeah, it's so ultrasound is just kind of like convenient, I would say, to because I mean, you guys as techs have like been taught to use it, and it doesn't take a lot of it doesn't take much to train someone to do it. It's easy to utilize and it's relatively cheap. I mean, we just kind of discussed how like it is cheap, but is it really like cheap enough to like buy it? um, and then also like it doesn't take that long, and you're low risk of like hurting your patient. So those are all like I think are like really good points, especially if you already have like ultrasound in your clinic. However, it's up to you as a therapist if you want to actually use it. Yeah, but it doesn't hurt. I suppose it just doesn't hurt um to try if the patient really wants to try it.
The units are pretty small too.
Mhm.
We've all seen it at this point, but every clinic I've seen has always just had it kind of like shoved in a corner, and
Yeah.
you don't really notice it until that patient comes out and is like, oh, I'd like to try this. And you're like, cool, we have that.
Hmm.
yeah, or it's just already attached to the E-stim unit or the TENS unit.
Oh,
Yeah.
I've
You
seen
might
those.
have to buy it if you're buying the Chattanooga one that already has it attached or something.
Uh-huh.
It would definitely be easily accessible if that's the case.
Yeah. Cool.
Right. Well, just to close off, I think it'd be good just for all of us to say, like each take turns saying if we feel like this should be utilized in relevant settings, and if so, like what setting do you think it could be used for? Since I'm already talking, I'll just go. Based on what we found in the literature, if you already have a unit and patients enjoy it, it could be good for patient buy-in and, like Maddie said, possibly some like tissue heating stuff. But if you don't already have a unit, I don't think it's worth it to go out of your way to purchase one, because literature, at least up to this point, does not suggest that it is as effective as other treatments such as exercise and various other range of motion stuff.
Yeah. For me, I'm pretty much in the same boat. I think another factor I would just want to really consider is if, like patient autonomy, if they already know about it and they think that it's going to help, or it helped them last time in PT and you already have the unit, you might as well throw it in. I wouldn't buy it for that reason, but I would definitely still throw it in that case.
Yeah, I agree with you, Maddie. Like, I personally probably will like never mention it to my patients unless like they mention it first. And I'll be like, oh yeah, we can try that. Like, why not? If you like it so much. But other than that, like, yeah, it doesn't hurt to try, right?
At a clinic I worked at, there was multiple PTs, and some of them loved giving ultrasounds and others didn't. And so that's when patients would bring it up, is because they'd be like, oh, what are they doing over there? And then we could like incorporate it. But I personally would rather use those 7 minutes for more manual therapy, or 7 extra minutes of exercise or something like that, rather than ultrasound. But we'll have to see how my patients respond.
That's a good point too, though, is that like 7 minutes isn't really that much time. Like when we're looking at the chart, we see that you can see benefits potentially in like as little as 3 minutes for, I think it was tendon tears. And so like if you have it, trying something out for 3 minutes isn't really a big deal at all. I'd be curious to see, which I had never really considered, but look at why patients actually do enjoy it for those that try it and want to do it again. Because if the evidence says that it's not actually working, is it more just placebo, or is it more just like you get to sit there and do nothing really, where you might think something's helping, but like it's not like STEM where you don't have to actually deal with any sensations except for those. I mean, there are people that say they feel it heating up, but it's hard for me to agree with that. So yeah, I mean, it kind of all depends. All depends on the clinic, all depends on the therapist. I'm on the same boat as you, Allie. I don't think I would like actively recommend it to patients, but I'm not opposed to using it if they wanted to try it.
Yeah. I think it's also like important to remember that, I mean, based off of what we've learned about placebo, like placebo is a good thing. And if the patient is responding well and has like good expectations for it, and it like, it's like encouraging like inhibition of pain, then it's like, why not, right? Like we just want to feel
it's
better.
universal in that aspect. Like there's
Yeah.
no clinic where somebody's not going to come in with pain.
Yeah. For sure.
So you could use it at sports, hospital, outpatient, regular. I can't imagine you'd use it inpatient too much, but
yeah, for sure.
Nice. So overall, thank you everyone for your thoughts. What we concluded, like we said, is that more evidence towards its effectiveness would be required to sway us. But that's about all that we've got for you. We appreciate you listening. Thank you all for putting in your 2 cents and sharing. This has been an enjoyable discussion for sure.
Yeah, thanks everybody.
And thank you.
good work.
Good work. Bye.